Okay, we're gonna get started.
Yep.
Welcome everybody to a Polk County Board of Commissioners meeting for Tuesday, February 20th, 2024. All commissioners are present. Please join me in the Pledge of Allegiance.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. First item on our agenda this morning is comments for items that are not on the agenda, limited to 3 minutes. And I understand that there's one or two people that have comments. So please come forward. Give us your name and address for the record. And then start your process. Yes, please. Mhm.
Okay, my name is Joanne Cosby, Cozby, 8317 Buffalo Lane in Grand Ronde. We have a little problem there between Fire Hall Road and Grand Ronde Road and Andy Riggs Road. We've got an RV that's just there and has been there for weeks, and it's dilapidated. I have pictures of it that I'd like to give the board. And we've asked law enforcement to do what they can to remove it. They said they cannot remove it because there are no parking signs there. We asked that the board consider putting no parking signs there. The pictures will show this guy or whoever it was has torn up the shoulder of the road, causing the integrity of the road to be compromised. There's logging trucks that go up and down that road on Fire Hall. He has black water that we don't know where he's disposing of that. And there's a salmon river right below that Rock Creek. There's a school bus stop within less than 100 feet from where he's parked. And it's quite the eyesore, and there's trash out in the forest showing all of that. We just ask that you consider putting those no parking signs, and that will give law enforcement the power to then tow away this vehicle, which appears to be abandoned. We haven't seen any movement for a couple weeks. We did talk to a law enforcement officer. He told us about they had to have a no parking sign, but he was also there on that day to enforce a warrant for the guy in there. He is a problem. Apparently he was parked further down on Andy Riggs Road, closer to Grand Ronde Road, and caused a lot of havoc there too. But we haven't seen any movement. The front windshield is completely smashed, and there's garbage. So I have a list of what the pictures show, and they're numbered, and it states it on the back. May I give that to Nicole, or? Okay, and that would be our request.
Thank you for bringing it to our attention. Questions? Okay.
I'm sorry, yeah, questions?
I'm just curious what our ordinances are for parking on that particular road, but we can discuss that another time.
Yeah, it'd be a better conversation if Todd and some law enforcement folks were in the room. The board and Todd have the authority to designate areas for no parking if there's a reasoning within the ordinance about whether there's a safety need or other road related need for that no parking signage.
Good.
One more thing, I used to be in the legal field, could create a liability for the board if somebody gets hurt with this thing, an accident or anything. There are logging trucks that go up and down that road all the time. So just to let you know. Okay.
Thank you.
Thank you.
Any other comments? Sorry, say again?
Regarding this,
No, any issue?
I'm Sue Bateman. I live next to Joanne.
Please come forward. You got to get on the record.
Give you your address.
Be official.
I'm Sue Bateman, 8325 Buffalo Lane, Grand Ronde. I have actually seen the black water going down towards the creek, the river creek, Rock Creek, and I've called law enforcement and they said that there's nothing they can do about it. And even if they could put something, if it's just no parking, no overnight parking, just something to deter these people from doing this. There was once, he's been there for, I'm gonna say he, because I saw a man going down to the creek one time. And he's been there for quite a while, but there was another one that started to park there. We're like, oh, great, here we go. And then there was a van, and it's just the kids being, first of all, the garbage that's being put into the rivers, the black water that could be going into the river. He doesn't have a car, so it's not like he can take it anywhere. And it's just a health hazard. And I know you guys know this is happening in a lot of places. But like Joanne said, if we could get something there that is at least no parking overnight, if, you know, something that shows people that they just can't stay there and dump their trash. And I guess that's it. Thank you.
Thank you. Appreciate you bringing the subject forward. I can't tell you how much this issue makes my blood boil. That we would have to cover our entire county with no parking signs to take care of what I think is a public trust and an asset that we shouldn't have to do that kind of stuff on. We need to fix this nonsense. So that's my personal opinion on it. I don't like the signs. And I think we need to have better tools out there so that we can keep our roads clear.
You know, there was nothing you could do about it, that we have to come here and talk to you because there is no parking.
We could have a debate about that too.
And, you know, it was frustrating, but Joanne and I decided, you know what? We've called and now we're gonna try to do something about it because it's just not right for people to have to live with that.
I personally agree with you. I think you're entitled to have a neighborhood that isn't spotted with that kind of blight.
And I just want to thank you both for coming today and put it on the record. This isn't the first location we have this in. We've spoke about this in the past. And it is something that unfortunately law dictates a lot of what we can do, but there's still got to be ways that we can get around it. So.
The legislator next? I mean, seriously, is that what I realized that I was told that there was something that went up to the Supreme Court that says you can't move people's abode.
Primary home.
Yeah, but it just doesn't seem appropriate that they can just litter. Thought we had laws against litter.
So if there's anything we can help with, please let us know.
Absolutely.
Thank you.
Thanks. All right. Moving on, approval of minutes of February 6th, 2024.
Also move.
Second.
It's been moved and seconded. All those in favor signify by saying aye.
Aye.
Abstain. I wasn't here. So next up is our public health update. Naomi?
Hopefully I have better news. All right, good morning, commissioners, and thank you for allocating some time on your agenda for public health updates. I'll start with the work ahead. So our work in public health is guided by 3 plans. The first one is the Public Health Modernization Plan, which is statutorily required. The second one, the Community Health Improvement Plan, which is outward facing and community facing. And then the third is our Polk County Public Health Strategic Plan, which is inward facing. And I'll start with Public Health Modernization Plan. So all local public health authority are statutorily required to have a Public Health Modernization Plan by the end of 2025. There are 2 pieces to this that is worth mentioning. So the first is the governing bodies of LPHA, and in our case, the Board of Commissioners, must review and make recommendations for this local plan. And this plan is aimed at showing how we will fully apply the foundational capabilities and fully implement the foundational programs that are in statute. So this year, 2024 and 2025, we will be mapping out how we will be developing this plan, and we'll make sure to incorporate spaces for Board of Commissioners to have updates and input so that you are fully aware of how this is going. And then OHA is responsible for approving the plan, so they will be sharing some tools to help us, to guide us in making sure that we develop a plan that is eventually approved. Any question on public health modernization plan? No. For the community health improvement plan, this we do regionally with Marion County and many partners. This year, 2024, we have kicked off the community health assessment, which will eventually inform the community health improvement plan next year. Public health staff, we participate in this work on behalf of Polk County Health Services. So we are the Polk County Health Services partner. And this is going well. We have built our capacity to have better data capabilities so that we can intentionally participate and make sure that this work can also help us meet some other requirements instead of having to duplicate work and do our own local work and then a regional work. So that's CHA-CHIP. And then great news, this year in January, we launched our public health strategic plan, which is internal facing, and it was developed by the public health staff. So we went through a whole year of different stages of providing input, identifying our priority areas, and we have launched it for the next 5 years. We have a one-pager of this plan on the website. It's just the high-level priorities. It's really to make sure that external partners can see what we are prioritizing in case they want to collaborate with us. So that's for the plans. I'll go over some of the budgets that are worth mentioning. First is the PE 51 public health modernization budget. Our work plan has been approved, and we are on track for meeting the requirements for this funding. Next, the COVID-19 funding that comes through PE 0110, which was going to expire. The expiry date has been extended to June 2025. Locally, what we're doing is we're taking the COVID-19 work and incorporating it into our communicable disease work so that once this funding goes away, it doesn't hit us hard. We're still functioning and still doing the work. And then the third funding, which is new, Willamette Health Council has allocated some quality incentive measure funding to public health, to local public health. So we received some funding last year and we've allocated that to helping us launch home visiting programs in Polk County. So we managed to use the funding to recruit some nurses, and we will be working on launching the Family Connects this year. So that's for funding. Program level updates. We have some updates for WIC. We have a new WIC coordinator who has been doing great. We've had some increase in enrollment in WIC. We have also moved the Monmouth office WIC services from the behavioral health building to the FCO building. This will be great because then our WIC clients can have access to other services in the building, and the other services can also refer clients to WIC services. So we're expecting an increase in enrollment there. Vital records, which had moved out of public health a while back because of limited capacity, has moved back to public health. We have, as we transitioned out of COVID, we restructured the public health team into a clinical team, WIC team, and we also have a public health education and planning team. This team is really working on helping us implement the foundational programs, or at least oversee and coordinate how we implement the foundational programs and apply the foundational capabilities. So we have ramped up our emergency preparedness capacity, communication capacity, and also our data capability. We want to start being able to pull our own data and analyze our own data. So we're working on that. And this team helps us do some of this public health modernization work. And then home visits, we now have Babies First and Cocoon in Polk County. We launched that last year, and this year we expect to launch Family Connect. So we now have home visiting programs for our community. So that's for program level updates. Staffing success. We have our new public health nurse supervisor who was promoted from her previous position as our communicable disease nurse. She started in January. She knows how we function. She's familiar with Polk County. She's been with us for 3 years and doing a great job. We also recruited some home visiting nurses last year. You will remember we've had some struggle recruiting nurses in the past years. So that's been a great success. We have a new WIC coordinator who joined us in December, doing an absolutely great job. So I'm excited about the WIC program. The only staffing concerns that we anticipate is because Emily Bratang, who is now our new nurse supervisor, has been promoted, excuse me, she has left a vacant position for the communicable disease and TB nurse. So we anticipate having some challenges recruiting a nurse in that position. But we are planning to try some new strategies in recruiting nurses. So hopefully we'll get that done this year. That is it from public health. This was really brief, but if you have any questions, I'm happy to answer those.
So your Babies First and Cocoon program and also the WIC, are you working with them, with community outreach and coordinating that together with them?
So the Babies First and Cocoon, we are going to be working with them to try and make sure that they know how to refer, because that one is still based in Dallas, and then we're working around that. The WIC has been easier because we have joined their building, and so the orientation of our WIC services to FCO has been pretty quick. So hopefully we will be working with FCO, not just for the Babies First and Cocoon program, but even our other clinical programs. We've been collaborating with them for other things too, yeah.
Great presentation. Thank you for being here. Quick question on the WIC program.
Yeah.
I serve on the Human Services and Education Steering Committee at NACO, and we talked quite a bit about the upcoming $1 billion shortfall across the United States for the WIC program.
Mm-hmm.
And we're seeing the shortfall as we're seeing more folks who are eligible sign up for services, which I think is a really good thing. But with the budget shortfall, do you foresee, is there any communication from the federal government down to local public health administrators on possible budget cuts or resource deficits?
So I have not received any communication on that in particular, but how WIC works is we get funding based on the numbers of enrollments. So we have had budget cuts in the past because we've had challenges and the number of enrollments had gone down. Hopefully, as the numbers go up, we will not be affected too much, but I have not received communication on that.
Okay, something else.
I will look that up.
You keep an eye on, yeah.
Thank you.
And then very happy that you are setting up office for the WIC program in the FCO building. I think that's fantastic. I love putting the public front and center for public health. And then I assume folks could get referred to other public health services, communicable disease, STD checks and the like.
Yeah, for sure. I mean, they can always get referred. It's just there's been referral barriers, transportation barriers that we're working on, but FCO has great ways to address those barriers as well. So this collaboration is going to be great. I'm pretty excited about it too.
Thanks, that's all I have.
So with regard to staffing challenges in my 13+ years here, I've constantly heard challenges about health staffing at the jail. So I don't see anything addressing the jail staffing. So I'm curious about your perspective on, I mean, where we are currently. What does it look like going forward? It's a difficult position apparently to keep staffed. So where are we at?
You're not wrong. We do have a lot of challenges. So jail does not directly fall under public health, although I oversee jail. So the jail clients, for example, are not public health clients, which is why I didn't add it to the public health presentation. We do have a jail medical team nurse manager who does most of the oversight over the jail medical team. He is a nurse. He's been very good in the past 2 years, almost 2 years that I've been here, in getting a backfill pretty quickly whenever he's had turnovers. We're still having challenges with turnovers. Some nurses come in and this is, not what they wanted to do, or for other reasons they do leave. But I believe the jail staffing, even though it's still challenging, it's been better compared to what it was more than 2 years ago. So right now we're down only 1 staff and coverage has not been as difficult. And hopefully we'll have a backfill. This staff left last week, so hopefully we'll have a backfill soon. I believe the jail nurse manager, Michael, is just doing a great job at finding people to backfill the positions. We still have a lot to do with retention and keeping the nurses that are there, and we just have to work on that.
Yeah, so I'm expecting that, given that when we take care of the folks in our jail with our staff, that our costs are better controlled. And that when we aren't able to do that and we have to refer them away to West Valley Hospital, that our costs are not controlled, and it's costing us and all of our taxpayers a lot more money. And so that's why I asked this question, and rarely hear reports about perspectives on the future. How are we planning to address it? I get it. It's a tough job to fill, but only you know for sure, I think, on what the long-term plan is and how we're going to address these challenges, because we can't be without the medical staff that's appropriate for the number of beds that we occupy in that building.
Yeah. Agreed.
With this tough, this fill that position, because it's not exactly a great atmosphere to work in. Would money help retain some if that position paid a little more than a standard position within the county for nursing?
I think money is one aspect. It would probably help us get candidates to apply if we had a higher salary, but the retention piece is not always about money. It's about being comfortable doing the job that you're doing.
The environment that they're working.
The environment they're in, feeling like they're good at their job and they're getting some job satisfaction from it. And jail it's a different space. Not only are you in a tricky environment or a challenging environment, but there's also there's turnover in the adults in custody, right? And so you're seeing somebody and treating them, and then they go away and you're seeing somebody new. In other spaces, you're seeing someone for the long run and there's more job satisfaction. So it's a challenging space to work in. It takes a certain character. So we just need to be better at finding folks that are, find satisfaction in that type of job.
A lot of folks don't know that people in jail lose their OHP, their insurance too, currently. That's correct. So that must be challenging too, to navigate health resources for folks who are uninsured.
Yep. And that's a statewide challenge and conversation to try and make sure that the coverage doesn't go away.
Mr. Chair, could I address something real quick? Because I've been dealing with the jail nursing challenge for a very long time. And I think Naomi's done a good job of making it clear, and I want to make it more clear that Michael, our nurse manager in the jail, since he came here, our recruitment has changed completely. So filling the positions hasn't been a problem anymore. Keeping people who, in fact, we just lost somebody who gave us notice after their last shift. They didn't tell us they were leaving or anything. So Michael is already working on that. So that's definitely a problem. But at the jail, we also fill LPNs. We don't have any RNs other than Michael himself. So our recruitment of nurses is still a higher struggle within public health versus the jail. And I think Michael deserves a lot of that credit because he's done a lot of really good things and networks very well.
It really has. And I've received great comments from the sheriff's office about Michael. So apparently even the relationship between the jail medical team and the sheriff's office has improved since Michael has been there. So that's been great as well.
And Michael's dealt with a complete turnover since he's been here. Everyone that works there now came after him. So, amen.
Yeah, and I want to add so the jail nurses are LPNs, and we have also lost nurses who have been working towards their RN. And then we didn't have a position for them because now they're an RN, and so they have to move on. So there's also, it's hard to provide progression to the nurses there. You have to be wanting to be an LPN for a long time, and on top of that, wanting to work in that space for a long time. So we do expect to have some turnover, but again, Michael has been doing great with backfilling the positions. So.
Okay, thank you.
Thank you.
Thanks.
Right.
Okay, next up is an Association of Oregon ONC counties letter of support. You've all seen this, been circulated. And this is basically asking for us to sign on to a cooperating agency status with the BLM and designating the Association of ONC County staff to be its designated representative for our current resource management plan process. This is a complicated process that we thought we had covered at the ONC, but we've been ignored essentially for the last 2 years until our last annual meeting in December, when the BLM staff said, oh, well, no, each county has to ask for that if you want AOCC to represent you. We've been asking and asking and asking, and finally got that answer. So this is the result of that December discovery. And I think it's very important for all of the ONC counties to sign on to this. There will be a few. I imagine Douglas County is one, for example, who will stay as their own representative cooperating agency. But I see no reason for Polk County to do that. And I absolutely trust that the ONC staff will do fine by our interests in this. And again, the root of this challenge is the resource management, the 2016 resource management plan that we have sued the BLM for in federal court and is heading for the Supreme Court. And we intend to try to get that resource management plan overturned and get them back on track with what the actual 1937 Congressional Act says they must do. So that's the root of this process.
For the record, you describe what ONC counties are?
Yes, the ONC counties are the Oregon and California railroad lands that are part of a checkerboard process in the Western Oregon exclusively. Why it had California in there is only because that was the railroad that was initially involved in all the land grants back in the late 1800s. So they've been designated Oregon and California railroad lands ever since. Polk County has acres in that. I can't remember, it's like 42,000 acres in that designation that, of course, we have a dear interest in making certain that it's managed appropriately and that we're able to harvest timber in a sustained yield management plan so that we can derive income. Polk County used to get a few $1 million a year from those resources, and now we get basically a welfare check from the U.S. Treasury when the bill happens to survive. So anyway, that's our process, and we are again suing the federal government. This has been a long process, and this is where we're at today, asking for our staff at ONC to allow us representation.
And I'll make the motion that we go ahead and sign this letter, move it forward for Polk County.
I'll second that.
Okay, it's been moved and seconded to move the letter forward. All those in favor signify by saying aye.
Aye.
Aye. Passed unanimously. Okay, thank you. And next is non-listed items. No.
None for me, sir.
Okay. All right, we're adjourned.